you're prone to chronic boils in your armpits, buttocks, breast, or groin, like this, keep listening. This could be a condition known as hidradenitis suppurativa. Hidradenitis suppurativa is an inflammatory condition, not an infection, and it's influenced by hormones and genetics. To start out with non-prescription options, we typically use antimicrobial cleansers to cut down on bacteria on the skin that could contribute to inflammation. Cleansers we use include HibaCleanse, benzoyl peroxide wash, zinc parathione, hypochlorous acid containing washes like Bosch Wash and CLM brand. We typically have patients wash with antimicrobial cleansers to affected areas daily. Other non-prescription options include supplements. We'll use vitamin D supplementation in patients who have low vitamin D levels. We also may use zinc with copper supplementation. It's really important that if you're taking zinc, you also take copper because high levels of zinc without copper can drop red blood cell levels. Dietary modifications also don't require a prescription. We have some data showing that reducing refined sugars as well as processed foods and cutting out brewer's yeast can help HS. Additionally, trying to follow the Mediterranean diet, which is focused on lean proteins and produce, can also potentially benefit HS. And I don't even want to mention it because it's obviously so much easier said than done, and this is a total judgment-free zone, but I feel like I wouldn't be giving you guys all the information if I didn't. If you happen to fall into overweight or obesity categories, it could be helpful to lose weight. Going into prescription options, we use antibiotics. Once again, antibiotics are used to reduce inflammation. This is not an infection. Your dermatologist would determine what antibiotics are appropriate for you, if any. We'll also use spironolactone because it could block hormones that contribute to HS. Your dermatologist may ask your primary care provider to prescribe you, or even may prescribe themselves diabetes medications because these could also help HS. Last but certainly not least, in terms of medications, we have 3 biologic medications that are FDA approved for HS, and these are all injections: Humira, Cosentyx, and Bimzelx. A non-FDA approved biologic medication we use for HS is Remicade, and it's an infusion medication. If you notice that you have a flare that's incredibly painful, you could actually go into your dermatologist and we could inject it with steroid. This usually cuts down the inflammation in a day or 2. Another procedure we'll do, particularly if someone always flares in the same exact spot every single time, is deroofing, where we'll literally fillet open the sinus tract, cut out the inflammatory debris, and let it heal from the inside out. If I could reiterate a few things about HS, it's the following. 1, if you have this, you are not alone. So many people have it, don't recognize others have it, and suffer in silence. 2, if you have this, please plug in with a dermatologist. As you saw, most of the treatment options did include prescriptions and procedures. 3, this is not contagious. 4, this is nothing you did wrong, and this is not a hygiene issue. As always, drop your questions and comments below and follow for more simplified skincare.